Hey everyone, it's Michael here at Home Health Success Academy, and welcome to the Module 6 portion of our How to Start Your Own Home Care Business. And in this video series, we share with you guys everything that you need to know in order to be able to start your own home care business from the top all the way to the bottom, meaning how do you start it and how do you run your agency and what you need to do in the middle to be able to get it going. And in this module, we're going to talk about the business startup requirements. So in other modules, we already talked about creating a feasibility study, creating your business plan, where can you get financing, how do you start up your business. We also talked about, other basic necessities that you need to do in order to be able to figure out, are you going to start a home-based business? Are you going to open up an office? Or are you going to franchise? Either or, we're going to give you all the do's and don'ts and the pros and the cons of each decision that you're doing. Now, let's go ahead and get started in the Module 6, which is the business startup requirements. So there are a number of legal issues and requirements that must be addressed and certain procedures to be followed before starting your home care business. You have to understand that you're going to deal with a lot of levels of government. You may deal with local, state, and even federal. So typically for federal, you're going to be dealing with, if you're going to be opening up your medical home health agency, we're going to be working with Medicare patients, Medicaid patients, as well as insurances, okay? But pretty much if you're opening up a non-medical or a private duty home care agency, you're dealing with local and state. And then you're going to register your business with a number of different government agencies for tax and employer purposes. So there's going to be a variety of different requirements like business registrations, employer registrations, licensing, things for your corporations and incorporations. For starting a business, it varies somewhat from state to state. So it is important to be familiar with your state's requirements, regulations, and procedures. So everyone that actually watches this video series and joins us for the full video series will give you every aspect or information that you need to be able to know how to find out what is needed in your particular state. So let's talk about legal issues. The services of a lawyer may be required if you opt for a legal form of business other than a sole proprietorship. It may also be worth your while to consult one, even if you intend to operate a business as a sole proprietor. Here again, it depends on your own level of expertise in legal matters as well as in the complexity of your business. Let's talk about insurances. Before deciding what insurances you will obtain, you should consult with an insurance agent. So guess what? You already have an insurance agent. Why do you have one? Guess what? You have car insurance. And just to let you guys know that your insurance carrier for your cars sells more than just auto insurance. So you need to be able to go to them first and ask them basic questions. Put them in front of you and ask them the questions like, hey, what type of insurance should I have? And we're going to detail this more further into our presentation. If you're going to be financing your company, advise your banker about your business plans. He or she can provide services which are both essential and helpful to you, primarily financing for startup and operating expenses, disbursement of financial advice, and setting up a business account. Because guess what? You need to have a business account separate from your personal account. This is a must. Even if you're doing a home-based business, you need to separate those two things, okay, in order to be able to, first of all, manage them correctly, and for tax purposes, you have them separated as well. Accounting, okay? If you do not have the expertise to set up your own accounting system, it is advisable to seek the services of an accountant. An accountant can assist by creating an accounting system, organizing and simplifying financial record keeping, ensuring that your accounting system meets governmental requirements, incorporating controls which can protect you against possible losses of cash and other assets, preparing financial statements, and evaluating financial data. Now look, if you're starting off, maybe you don't want to use an accountant, but guess what? There are a lot of, online services out there that you guys can actually do and use, like for your billing purposes, for your employee payments, payroll, your expenses. There's a lot of, companies out there. One of the things that I always suggest people when they're starting off from scratch and trying to penny pinch their business, QuickBooks has a perfect system, especially for small businesses and startups. And what you can do is you can do everything with QuickBooks. Now, there's other companies out there. It's just QuickBooks is something that I'm familiar with and I've used in the past as well. But once your business starts growing, you definitely want to be able to make sure you bring in an accountant for, who specializes in business. Don't talk to your H&R Block people, because those people are not going to be able to help you out really. Okay, so I want you guys to understand accounting is one of the most important part. Why? Because you need to know, hey, am I making money? Am I actually in the negative or am I in the positive part of things? You need to be able to have a good accounting systems. And as you go up in your business, you'll have your CRMs for your patients, and you're going to be using like computer systems that can, make it easier for you to be able to count up all the hours that are being provided, care being given to the patients, and all a variety of different other products and opportunities for you out there. Now, first of all, when you're starting your business, you need to decide which business structure, are you going to be putting yourself into. So there's that decision that needs to be made right there and then, about the legal form of business that you're going to set up. Is it going to be proprietorship, a partnership, corporation, an LLC, or a sole proprietorship, right? If you are an individual just starting out and want an uncomplicated, easy to set up structure, then a sole proprietorship may be a suitable choice for you. But at the same time, as you also have to understand, a sole proprietorship puts you in legal limbo as well. And this is where you need to be able to possibly speak to a lawyer or, work with a company who handles the incorporation papers that can give you further advice and information about maybe which one would be suitable for you. One of those companies is called LegalZoom. That's something that you can get a lot of great free information before you make a decision on what you want to do. So if your business will consist of 2 or more persons and you want the business to be relatively simple and largely unregulated, then a partnership may be suitable. If you are concerned about protecting your personal assets, which you should always do, okay, that's why you have to keep things separate, so you want to be able to protect your personal assets from your business debts and obligations, then you should consider a corporation, an S corp, something really good to be able to have in the beginning of a company, or a limited liability company, or what they call an LLC. Each form has its own advantages and disadvantages, but the key to selection revolves around the issue of taxation and liability. You must decide which form best suits your home care business needs. So, common business structures. The main types of business structures include sole proprietorship, partnership, LLCs, and corporation, whether it's an S corp or a C corp. So let's talk about sole proprietorship. This form is the simplest and is very easy to set up. It is a common form of a self-employed person in a home-based business. A sole proprietorship is a business that is owned and operated by one person and is free to operate more or less as he or she chooses. There is no legal distinction between the individual and the business. So an individual benefits from all the profits and is personally responsible for all the debts and liabilities of the business. The fact that the owner of a proprietorship is personally responsible for any business-related debt means that if your business doesn't pay any of its financial obligations, you, all right, pay attention, you personally can be forced to pay. Personal liability for business obligation is an attribute of a sole proprietorship. Insurance is available to cover these pitfalls, but the cost may be prohibitive. Moving on to partnerships. Partnerships, like sole proprietorships, are subject to relatively little regulations and are fairly easily to be established. Now, usually when you hear the word partnership, it refers to a general partnership. By carrying on a business with the objective of making a profit, you and your partner create a partnership, formal or even informal. A partnership is a legally binding business relationship in which each other partner, each person is gonna, take personal responsibility and become liable for the actions of the other partner. This includes actions that may be taken without a partner's knowledge. This risk is part of the business structure, so choose who your partner is going to be and choose them wisely. Let's talk about an LLC really fast. An LLC is a blend of some of the best attributes of a corporation, partnership, and sole proprietorship. It is a separate legal entity like a corporation, but is entitled to be treated like a partnership for tax purposes. It is very flexible and simple to run, and like a proprietorship, there is no statutory obligations to keep minutes, hold meetings, or make resolutions. The limited liability company is becoming the business structure of choice and is gaining momentum as more people learn of its existence. Moving on to the corporation. So a corporation is a legal entity separate from its owners, the shareholders of the company. Each shareholder has a limited liability. It has its own rights and duties and can be created for any size business. Although this can be more complex and legally costly than a proprietorship, partnership, or LLC, it is an effective way of operating a business. This is a common business form for larger home care agencies and franchises. You should seek some professional help if you feel that you want to incorporate your business. So let's talk about choosing, searching, and filing for your business name. Once you have decided upon a legal business structure and have come up with some potential business names for your business, you will need to undertake a name search to see if it is available for filing and registering. Now, I want you guys to pay attention, okay? Because this is something that I see a lot in this industry. I would go to a city, for example, and I will find out that there are 3 companies named Advent. You're going to have Advent Home Health Agency. You're going to have Advent Home Care. Then you're going to have Advent Home Care Agency. Or you're going to have Accredited Solutions. Or you're going to have so many, they're going to be sharing the same name, a couple different words in the end, and they're running their business in the same city. Now, this is one of the biggest mistakes that you can make. And why is that? Imagine if you're this one company called, let's say, Advent Home Health, does something bad or makes himself look bad. Imagine you trying to come into this business or come into a potential referral source and say, hi, I'm Advent Home Care. Most people out there, correlate home care and home health. It's the same thing. And they may look at you as the same company as the others. So this is something that you want to try to avoid. So, making that decision of choosing your name is very much an important thing to do. You will need to conduct a name and or trademark search to make sure no one else is using the name you want to use to market similar home care services. You should also check with your county clerk's office to see whether your proposed name is already on the list of fictitious or assumed business names. So when you go to your website, so let's say, for example, Illinois, you want to be able to search for companies and corporations, you would go to CyberDrive Illinois, and you can actually do a search in that website to see if other people are using similar names. And I won't just write, let's say, for example, I'm trying to go after XYZ Home Care. I'm not just going to type in XYZ Home Care. I'm just going to type in XYZ and see what other names are using that first word, and to see, are there similar things? Because you might find an XYZ Home Health Care and you wanted XYZ Home Care. So those are little things that you need to be able to make sure you do it correctly. So you should also check with your county clerk's office to see whether your proposed name is already in the list, right? So you need to be able to do that. If you find that your chosen name is registered as a trademark or is listed on a fictitious or assumed name registry, you shouldn't use it and choose a different one. So when you're choosing your name, when you make that decision, go ahead and write down maybe the top 10 that you want to do or use, and then you then funnel it down to the top 5, to the top 3, and then to the top 2, right? So you have 2 choices right there and then. That's something that I truly advise you guys do. And if you're organizing your business as a corporation LLC, you must also make sure your business name isn't the same as that of an existing corporation or LLC in your state. If a name that is identical or very similar to your proposed business name turns up in your state's database, you will have to choose another. Now, from getting into trouble, you should understand the basics of trademark law, which prevents a business from using a name that is likely to be confused with the name of a competing business. If you choose a business name that's too similar to a competitor's name, you might find yourself accused of violating the competitor's legal rights. It's called a trademark infringement, or also called unfair competition. And you could be forced to change your business name and possibly pay monetary damages. If you are concerned about someone else using your business name, you may want to consider registering your name as a trademark in your state. Trademark registrations will protect you if another business decides to use your name. You can try your state's Secretary of State's website for trademark registration information, or you can contact a trademark lawyer. There's only one way to ensure that you won't violate someone else's trademark rights: do some searching to find out whether another business is already using a name that's identical or similar to the one you actually want to use. Let's talk about fictitious business name. So, for example, when we help open up an agency in Florida, located in the Kissimmee area, what they had a corporate business name, right? It was a S corp type of a company, but what they also did is they also had to register a fictitious business name. Okay, and so by them doing that, they're able to create a fictitious business name, an FBN, and use that as what they have in their company marketing. So any business that doesn't use its own legal name, meaning official name of the person or entity that owns the business, as part of its business name is required to file what we call a fictitious business name or an FBN certificate. Fictitious business names are sometimes referred to as assumed names, or this is something that you probably hear a lot, DBAs, or doing business as. So this is something you're going to see a lot with franchise organizations, right? So you can't. So let's say, for example, Visiting Angels in the state of Georgia. Let's say there's several Visiting Angel companies out there. So you can't use the Visiting Angels Corporation as a name. So you would have to create a corporation name. You know, whether it's an LLC or a corporation, S corp or a C corp, and then you would do a doing business as Visiting Angels. Okay, so that's one thing that you would have to kind of work with. And of course, it all depends on how you want to be able to handle that. If you are franchising your company, I'm sure the franchisor will give you advice on what and how you need to be able to apply for those names. Now, you want to be able to search your fictitious business names for previous registrations. You will need to search your county or state database before registering your FBN to ensure it isn't already registered. If you are close to the county clerk's office, you can perform your own search using their database. You can also take a look at your state's official website or county website to see what resources they have available for performing a name search. On some state websites, you can perform a name search as well as a registering online. Registering your fictitious business name. The rules for registering your fictitious business name depends on the type of business structure you decide to use for your business. Your FBN registration will usually be good for a certain period of time, usually 5 years, so you will want to note the expiration date and renew it. Also, if certain aspects of your business change, such as the legal structure or an address change, you should notify the appropriate government agency as well. So how do you register your business with the state? Well, generally, businesses operating as limited partnerships, registered limited liability partnerships, limited liability companies, corporations, professional corporations, or even nonprofit corporations must register with the Secretary of State or other state agency. Each state is different, but typically you will be registering with the Secretary of State. In some states, if you form a sole proprietorship or a general partnership, you don't need to register your business with the state at all. So like I said, always consult with a lawyer or do some research yourself. So one thing you would have to do also once you have your company set up is to be able to apply for an EIN, also known as an employer identification number. An EIN is a federal identification number issued by the IRS to identify a business entity. It is also known as a federal tax ID number. Legally, you are required to identify your business with one of two numbers, either your social security number or an employer identification number. Pretty much think about an EIN as the social security number of your business. You need an employer ID number when your business is new, hires or will hire employees, is an LLC or a corporation, opens a bank account, and or changes its type of business structure. Opening a business checking account. This is also important. Like I said in the past, you always want to keep your personal from your business. Now, if you have a sole proprietorship, you still want to keep things separately because you don't want to intertwine your expenses with the business and your own personal self. This is one of the quickest way to not even manage your business well, is if you keep both of them, pretty much sharing information. You should open a separate business account for your home care business. You will have to provide the bank with your original fictitious name statements, as we discussed earlier, before the bank will open a business account for you. By having a separate bank account for your business, it is much simpler to keep your personal and business transactions separate. It just is. Once your business account is open, you can have your clients make payments to your business name and you can go ahead and make deposits. And one thing I always teach people is that try to see if you can set up something online so that you can go ahead and bill your patients directly. So this is, one thing, like I said in a previous video, we talked about QuickBooks. It's a great software to manage your accounting, but at the same time as you can do your billing there as well, and allows to receive payments by through the phone or sending invoices. They can pay through their phone, their computers, and you'll just have an automatic payment into your bank account that you set up with QuickBooks. So that's one great advice that you can also use. One thing that you can also look into is obtaining a seller's permit. If you plan on selling any tangible goods, equipments, home care products to the public in your home care business, most states require you to have a state seller's permit. To obtain a seller's permit, you need to contact your state's agency that governs the sales taxes. The process is pretty straightforward and involves submitting an application form and usually paying a fee. Now, why would you need a state seller's permit? You're offering, services as hourly staff members that provides home care or caregiver. Well, let me give you an example. One great thing to have in your business is multiple flows of income. And the reason why you should have that is because there are times where your patients may not need your service anymore and they'll get discharged, or they decide that they're a lot better, they don't need services. So one thing that my team does is that we offer a variety of different, what we call second sales to clients. We have our medication reminder program, for example, and a lot of agencies, take advantage of that program, and we use it ourselves for our patients. And what we do is that when a patient, is with us, we allow the patient to be able to use the medication reminder program for free as long as they are working with us. When they get discharged from us, some of the patient's family members still wants to have that medication reminder for their mom or dad or grandparents. And so, we sell them that product where they get reminded every day to be able to use these services. So that's our second sale. We also have additional things like, for example, our medical emergency button that we give our patients for free. That's something that we provide for free of any client that we provide services to. If needed as well, and the patient decides to go home or be discharged from us, if the patient still wants that product, they have the right to be able to purchase the product from us and continue on from there, which allows us to have a second sale as well for that particular product. And so these are little things that you need to be able to be aware of. What additional things can you provide services for? And how can you actually make additional forms of income within your organization? So if you are going to be selling a product, a tangible goods or products, this is one idea that you guys can actually have and provide for your patients. Okay, so let's go ahead and talk about how to obtain a state home care agency license. So if you're offering a non-medical private duty type of home care company, the licensing requirements vary from state to state, and consequently there are no uniform licensing standards for non-medical home care businesses. If you're opening up a medical home health agency where you are planning to bill Medicare and Medicaid and those kind of things, there is a uniform licensing standard across the whole United States. You have to apply with the state that you're in to apply for that particular licensing, and to be able to make sure that you will get a state survey. A surveyor is going to come in, whether it's offered by the state or you would have to go with some accrediting bodies like JCO or CHAPS, for example. But for non-medical home care, there is not really a standard all across the U.S. Some states require that you actually sign up with the state. Some states just, make you apply for a business license in that particular area. So you need to be able to make sure that you know which one's which. If you are using and taking our full training program, we're actually going to give you guys the links to each one of your states' website that gives you the detailed information on what's needed. Now, each state has its own requirements, for doing business, as we said, as a non-medical home care agency, and has the authority to license and regulate its home care system. So licensing requirements also depends on the types of services you provide. So some states do not require companion sitter or personal care agencies to be licensed with the state health department. A person needs only advertise and get a business license and start hiring employees. But of course, if you will be hiring employees, you have to make sure you have your EIN number, or the Federal Employment ID number. On the other hand, some states require those agencies who wish to provide personal care services to meet the more stringent rules under which traditional home health agencies operate. This might include hiring trained employees, the use of service care plans, criminal background checks on employees. Now, just to let you guys know, just because it's not required in your state to do criminal background checks, this is something that you should definitely do if you are going to be hiring some people. Okay, there may be periodic inspections by the state health department and as well as bonding. So in a previous module, we talked to you guys about making sure that you guys actually get licensing, get insurances, get your bonds as well. And those are just something that's going to provide protection for you as a person who owns a company and provides protection for your company as well. It is important to contact your state licensing agency. Usually your state's health department is in charge of this, to find out the current licensing requirements before you start a home care business. And this is something that you definitely need to be able to look into. And also understand, let's say, for example, you're going to be deciding to start a home care company, and there could be a possibility that during your process of application that things can change. So you always want to also get the updates regarding any potential changes. So obtaining a local business license and permit. Most cities, wherever you're going to be running your business, requires that all the businesses, including home businesses, that are going to be running a business in that city needs to register and obtain a business license for which a small fee is charged. Typically, you'll see them range from $35 all the way up to about $200, depending on the city that you're in. A home-based business is subject to many of the same laws and regulations affecting other businesses. So you must be aware of local zoning regulations as well, since your home is most likely in an area zoned for residential use. The types of businesses allowed may likely be somewhat limited, but most cities and counties allow home businesses. Also, if you are living in a community that has what they call HOA, homeowners associations, you need to also make sure that the homeowners associations allows you guys to actually run a home-based business, because this can actually also affect that particular setting. So make sure even your homeowners associations allows you guys to have a home-based business set up at your home. If you're operating your business from your home, you will probably require what is commonly called a home occupation license permit. Every city, municipality has different requirements for operating a home-based business, so you should definitely check with your local city hall for licensing information. And more likely, you can just give them a call, or you can even go to the local website of your community. Your city's website, like I said, is a good resource of information, and in some cases you can even register for a business license online without even having to go into the city office. Businesses located in rural or unincorporated areas must usually register with the county clerk. So when individuals are hired as employees, when you are going to start hiring employees, because guess what? If you want to start off by saying you're providing the care for your first patient, you can definitely do that. But once you start bringing in clients, you need to be able to hire new employees. Also, if you're the owner of the company and you decide to start providing care for that first client, who's going to be out there marketing for your services? You have to have somebody out there marketing full time. That's the way to grow your business, okay? Try to think about it. When you open up your business, any job that is less than what you feel your salary should be hourly should be given to somebody else less. So that if you think that you're worth $50 an hour, anything below half of that, any work that's going to cost $25 or less per hour, you should be able to siphon that out to somebody else to do, right? So what is the most important part in your business? Getting patients, getting clients, increasing your census. So you will be hiring employees. So in that case, in an employer-employee relationship, always understand that you control what will be done and how it will be done. In such relationships, the employer, you, provides required job training. Okay, so you have to provide training. the last thing you want is bringing somebody in who doesn't even have experience in providing personal care or caregiving, because some states you don't have to be certified caregiver. And the biggest problem with that is you can't just give them pamphlets to read, or expect them that they should know what they do, or sit them down for an hour and tell them the job that they have to do. You need to be able to make sure you provide them training. I mean, like for example, by going to PassingAnow.com or caregivercertificationonlinenow.com, you can provide an online learning platform for your new caregivers that comes in, and they can actually watch those programs and they can see what type of services they can have, and also they have to take a test to be able to pass that. So if your state does not require certification for the caregivers, that the personal care assistants, that does not mean that you do not provide them training, because guess what, if they are not trained, how can they provide the right care? It puts a risk to your own clients and puts a risk on the name of your company. So you must provide training. You must provide, like for us, we make sure that we do a quarterly training with our employees, making sure that they are being given continuing education, whether it's additional dementia training, whether it's, transfer training, whether it's medication reminder training. Either or, you have to provide additional training for your staff. The employer, that you, also controls and supervises them. The employer, you again, directs what work will be done and how it will be done. You're going to set the hours and define the work priorities for them. Also, you as the employer will pay the wages either by the hour or some salary arrangement with them. So you must understand that there is going to be that employer-employee relationship that's going to be involved. Now, you need to make sure that these following forms are always filled out for anybody that you hire. The W-4 form, have each new employee fill out a W-4, which is an employee's withholding allowance certificate. If you have had a job at one point in your life, guess what? You have filled out one of these forms when you were hired. You have the I-9 form, right? You complete the form I-9 for each new employee and retain for your records. The I-9 is a U.S. Citizenship and Immigration Services form. Is that person that's working for you, are they allowed to work in the United States of America? Guess what? If you've been in this industry or you're getting started in this industry, you will discover that there are home care companies out there that that hire people that should not be working in the U.S. The reason why they do that is because they're able to pay them lesser so that they can actually have a lower charge. But guess what? You don't want to put yourself in that type of a predicament, okay? So you must and you should only hire people that are allowed to work in the United States. IRS Form 941. This is a quarterly report, details the wages, federal income tax, and Social Security tax applicable to your company's payroll. So this form right here, if you're using an accountant, guess what? He can take care of that for you. If you're using an accounting software, this is something that can be pulled out from that as well. Also, if you're using a payroll service, like, so either your bank that you're working with, they can set you up with a payroll service that can actually handle this portion of things. So you should look into those things as well, because guess what? You have to pay your taxes, right? You also have your IRS Form 940. This is the annual report to the IRS that computes a total year's federal unemployment tax liability for your company's payroll. And I will tell you one thing, I have worked with multiple agencies out there and have found out that these are the problems that they forgot to take care of these small things. I want you guys to understand that taxes are no joke. You have to make sure you take care of these things before you start paying yourself or worrying about yourself. Make sure the taxes are done, because you can get in big financial trouble if these things add up. In addition to that, you guys have to understand one thing, that these small things, if you decide to push it to the side, will eventually catch up to you, will eventually build up. If you try to cut corners, things will eventually add up, and you're eventually going to have to get through them and finish them and take care of them. And if you don't do that, guess what? When they all add up, it's going to be a big thing for you, and then all of a sudden you're going to have difficulties and you're going to be worrying about this particular item. And I want you to make sure that you guys don't cut any corners, and that's why we're providing you this full training right here. Record storage. This is important as well. Books, records, and supporting documentation such as sales, payroll, and service invoices, purchase receipts, Bank statements, canceled checks, and contracts must be kept at the business site and should be stored in a safe location. Now, in the beginning, you can use paper items, paper documents, and that's a great thing. But as you increase yourself, my true suggestion for you guys is going paperless. And this is when you start using some of the nicer CRM systems out there that are made for home care services, because you can have everything done in there as well. And also bring in your QuickBooks software as well, because guess what? What I do is, if I get a receipt, I can take a picture of the receipt, store the information right there in the cloud, and I have all my information right there and then. And so you don't lose these things. So you want to be able to make sure that you keep a good record of everything. The length of time that you must keep your business records is determined by the government and must not be destroyed unless with written permission is given by the relative governing authority. So typically the average keeping of the records is around 8 to 10 years. So, it's up to you how you want to be able to handle that. If you start going into a paperless system, what you can do is you can hire a company, or you can pay for someone who can then just go ahead and scan all the documents that you have and put it in the cloud or put it in the storage. And then you can get rid of those items. At least you have the information that you need. But either or, make sure you keep records of everything. Complying with required regulations. As an employer, you should be familiar and comply with required laws, regulations, and standards. Larger organizations, guess what? They have an HR manager. Okay, so, and for smaller organizations, like you're just starting off fresh, guess what? You don't have the funds right now, or you don't want to put in together an HR manager right there and then. And so you must be knowledgeable about all the regulations and standards as well if you don't have an HR person involved. There are a lot of companies out there that you can outsource your HR information to, and that's something that is great to look into further on as you go. The main ones the home care industry needs to follow are outlined in the following information that we're going to be sharing with you guys. So, federal labor law. The U.S. Department of Labor administers a variety of federal labor laws, including those that guarantee workers' rights to safe and healthful working conditions, a minimum hourly wage and overtime pay, freedom from discrimination, and unemployment insurance. All businesses are subject to federal minimum wage, overtime, and child labor laws. Information on these and related federal laws may be obtained from the U.S. Department of Labor. Another suggestion that I have for you guys is that once you guys start hiring people, there are, I would truly suggest you can do a quick search for your federal labor posters. There's these posters that you can post in your break room, in your office, and you can purchase them. They're plastic wrapped and everything. And what you can do is you can have it in your poster board. You can put it in your office, wherever it is, and it has listing of all the labor laws there, both federal and state as well. So make sure you purchase one of those as well. And some states require that you actually have those in your office as required. There's a state labor laws and employment laws. Your state Department of Labor administers state employment and labor laws, which it's responsible and which might differ from the federal equivalents. The department is responsible for establishing the employment standards for your state. These standards are usually made law via an act or regulation. So a good example is that the minimum wage. There's a federal minimum wage that is out there. But there are some states, like for example Seattle, that has their minimum wage now at $15. So if the state says it's $15, you have to abide by those rules, because that's what is applied in that particular state. So be able to make sure that you know your state's requirements and laws. OSHA, for example, the Occupational Health and Safety Administration requirements. The U.S. OSHA is an agency of the United States Department of Labor whose purpose is to prevent work-related injuries, illnesses, and deaths by issuing and enforcing rules. These are called what we call standards for workplace safety and health. OSHA federal regulations cover most private sector workplaces. The OSHA Act permits states to develop approved plans as long as they provide protection. So you can research OSHA policy and procedures. You should definitely have one of those as well in your office space. Then there's the employer responsibilities for collecting, paying income taxes, WCB, and UI. As an employer, having employees, you're responsible for several federal, state, and local taxes. You must withhold certain taxes from your employees' paychecks. Federal employment payroll taxes, including the following: the federal income tax withholding, their Social Security and Medicare taxes, that's the FICA, Federal Unemployment Tax Act, called FUTA. So if you ever look in your paychecks, let's say you made $2,000 this week when you were working for someone, then all of a sudden you were down to $1,000. That's because they already removed the FICA, and as well as the federal income tax, and as well as the Federal Unemployment Tax Act as well. So that's why you don't keep all your money. Okay, so these are things that you need to be able to make sure that you, first of all, withheld from the employees yourself, and also you use that to make sure you pay the government. So whatever you take out, make sure Uncle Sam gets that as well. He has to get his cut. Federal tax withholding. You must withhold federal income tax from your employees' wages. To determine the correct amount necessary to withhold from each employee's paycheck, you need to have a signed Form W-4 from each employee. The amount of income tax withheld is based solely on the employee's claimed marital status and number of dependents. The FICA, you are required to withhold Social Security and Medicare taxes, commonly called FICA taxes, from your employees' wages. The SS and Medicare taxes have different rates, and only the Social Security tax has a wage-based limit. So you, as an employer, you must also pay a matching amount of these taxes. Are you aware of that? Did you know that you starting a business, that every time somebody pulls out Medicare from you, that they actually have to match that? So guess what? You have to match that. And this is what we start talking about. Just because you're paying an employee $12 an hour, it's not really going to cost you $12 an hour, because you have to match the withholding of Social Security and Medicare taxes. Okay? So these matched amounts are paid to the IRS along with other withholdings, and are allowed as a tax deduction to the employer later on. Then you have your FUTA. So an employer, you must contribute to the Federal Unemployment Tax Fund on behalf of your employees. The collected funds are used to compensate individuals who have lost their jobs. So FUTA imposes the tax on the first wages paid to each employee annually. However, you are given a credit if you contribute to a state unemployment fund on a timely basis. Let's talk about the state income tax. So as an employer, you will need to register your new business with your state's taxation department, which is usually your state's Department of Revenue, for employee withholding tax. Most states have a personal income tax, which means you are also required to withhold this tax from your employees' wages in much the same way as withholding federal income tax as well. State unemployment insurance. As an employer, you will have to register with the appropriate state unemployment department agency that is responsible for unemployment insurance. Each state administers a separate unemployment insurance program within guidelines established by federal law. So you, as the employer, you must also pay unemployment taxes to your state unemployment funds. Workers' compensation insurance. It is a legal requirement that employers carry workers' compensation insurance. In most states, coverage can be obtained through private or common carriers, while some states have a state agency that sells workers' compensation insurance. So if you wish to be personally covered by workers' compensation, you will have to apply for coverage for yourself. Many states give you the option to self-insure as well. So those are just the basic information that we want to be able to give you. I hope this was valuable for you guys. Like I said, if you want assistance to put in the application, we can definitely do that for you. But we will provide you guys the links of the places where you need to be able to register to go into your state's website to be able to know how to be able to finish the application process. Most of the applications for each state averages about between 20 to 25 pages worth of information. And it's pretty self-explanatory. And some states actually have videos that will show you how to fill out those forms as well. And that is something that you're going to have to put together. Our goal is to be able to give you every single information so that it's going to be easier for you to be able to put the application in to be able to create and start a successful business. Hey everyone, it's Michael here at Home Health Success Academy, and I just want to say thank you for joining us on this quick video. My intentions for today is to be able to get you guys to start using our online marketing university. The intention here is to be able to have you guys make sense of why joining our online learning platform is what's going to be able to create success for your agency. Okay, and we want to be able to give you all information that you need to create success. A lot of agencies nowadays are having problems how to be able to get more referral sources, how to be able to get their current referral source to give them more patients, how to go after past referral source that you lost to another agency, how to be able to increase your revenue, right? A lot of agencies are closing down nowadays, and our intention is to be able to give you all the knowledge that we share with clients of ours that pays us thousands of dollars to be able to manage their marketing team in their agency. So we're reaching out to home health agencies. These are the skilled nursing agencies, right? That bills Medicare and insurances and Medicaid. Then we also want to reach out to the non-medical, the caregiving and homemaker agencies, and especially hospice agencies as well. And we definitely want to be able to have owners, administrators, especially marketers and liaisons for companies to be able to take this online program, an online platform that's going to give you everything, all the knowledge you need to be able to create success in marketing your company. Remember, marketing your agency, selling your services is 100% of your revenue and is in charge of pretty much paying your salary, paying your employee salary, paying your co-worker's salary. This is what we have in our online university. We're showing you how to be able to create your target market, how to be able to look out into the area that you're in, figure out who are the right targets you need to be able to hit, who are the ones you should be visiting, who should you be following up with. We're going to show you how to create a sales process. If you are a company that does not have a sales process, that does not understand a business cycle, this video is important for you, right? When you guys admit patients in your company, you guys have an admission process, right? And if somebody skips something, if somebody shortcuts something, things may fall through. Same exact thing when you're marketing your company. You can't just go out there and think things are going to happen naturally. Okay, so we're going to show you how to do the sales process, how to do your presentation properly. What are the mistakes that you're going to be facing, right? Because we all make mistakes, but guess what? We've made mistakes ourselves, right? For me, for example, I made a lot of mistakes in marketing, but I figured out how to be able to handle that so that I don't do it again. Or if it does come up, how can I actually solve it faster? How to handle objections. You guys heard it all. We don't have time to meet with you. We are already working with another agency. Oh, you know what? I don't have any patients that needs home health yet. You know for a fact that that doctor just took care of another patient that had home health services. How to be able to learn how to get into the front of the nursing homes, into the hospital's preferred provider list, the do's and don'ts of marketing. You know, how to be able to find out different marketing strategies. What should I be giving out to people? Should I have lunch and learns? Should I not have lunch and learns? How much should I spend in a marketing target? Cold calling scripts. A lot of us don't even want to cold call. People are saying cold calling is dead. The reason why people say don't make cold calls because they themselves have quit on making cold calls because they themselves have faced so many objections. But guess what? If you are able to create an appointment, you have a 70% chance of getting that business than walking in cold by yourself live. Okay? So you guys have to understand, how do I handle a cold call? That's very much important. All these different series is available individually if you want to purchase them. If you want to purchase just the follow-up techniques, which we will show you guys a follow-up technique on how to be able to increase it, right? We're going to show you guys day 1, day 2, day 3, day 4, day 5, every single thing you need to do to be able to increase that potential referral source to refer patients to you guys. You can purchase that particular series by itself, that for $199, or we're going to share with you guys our membership platform, okay? So let's go ahead and talk about that, right? So like I said, you're going to have access to each one of these courses. You're going to be able to purchase these individually, but if you join our online marketing university, which we have a membership program that we're going to share with you guys in a few. So that's what we do at 10xpatientreferrals.com. This is the particular website right here, okay? When you go into that website, you're going to see 3 memberships, okay? 3 memberships. We have our platinum, our silver, and our gold membership, okay? And so right now as we speak, okay, right now as we speak, we talked about our online, our boot camp that's coming up all over, right? So guess what? By the end of 2018, we're going to remove a special thing that we're doing, okay? And so what we're doing is right here, right now. Platinum membership. You get full access on all the courses. If you purchase them individually, it's over $7,500 in value. Okay, just to let you guys know, when you purchase a particular series, you only have access to that for a whole month. Okay, so if you want access to this every month so that you can keep on going back and learning, right? You would be paying $7,500 a month by just accessing those. But guess what? For a platinum series, it's $149 a month. You have access to all of that. Plus, you get part of our quarterly mastermind meetings. That's a $3,000 value. And you also have access to us for 1 hour a month for coaching. Okay, that's a $2,500 value. And at the same time, as we talked about our boot camp that we're having, you'll get one free ticket to any one of the boot camps that we're having. So separate it all totally, it's about $9,500 worth of value. And you can access that for $149 a month. Now, things go down a little bit. If you just want to do our silver membership, what's going to happen is you get the full access and you get a one ticket to our bootcamp events. But just to let you guys know, we are going to be taking out that bootcamp ticket soon once 2019 hits. So if you want to sign up right now to get that free ticket, okay? So right there alone, we suggest that to you guys at $79 a month. Now, if you want something in the middle, which most of our clients are using, it's just our gold membership. You get full access to the whole courses, you get one ticket to live bootcamp, and you get the quarterly mastermind meeting available as well. So right there alone, we have so much information that we want to be able to give to you guys, and we want you guys to be able to access that right now. So you guys should definitely join. Like I said, I want you guys to be able to join this because this is what's going to create success. A lot of you guys are saying, hey, well, $149, that's a lot of money, Michael. I totally understand that. But guess what, guys? Let me ask this question for you guys. If I can show you, and with the techniques I give you guys, and you guys just get one patient by learning the tips, tricks, and techniques, one patient in a whole year, if you are a skilled nursing home health agency, how much is one patient? That's about $3,000 to $4,000 that you're going to get as from Medicare, from the insurances, depending on the billing. Right there alone, it already paid for this particular item. But our goal is not to get you one patient. Our goal is to be able to double your referral sources, to increase it, to increase your patient census. That's what our main goal here for you guys is, to be able to learn how to be able to handle gatekeepers, how to get the appointments, how to present correctly, how to get physicians to start referring patients to you, to get these social workers to start using your agency. Once again, this is Michael with Home Health Success Academy. You have to understand, agencies are having problems getting more referrals. A lot of larger agencies are expanding, opening up their own non-medical, adding hospice to them. So this is a cutthroat industry we're in right now, and then the person that actually educates themselves and learns how to succeed is our one that's going to be able to succeed and beat the other competitions. And if you don't join this, guess what? Your competition is joining this. If you don't attend the boot camp, guess what? People around your area is going to be attending the boot camps that we're having. So like, for example, our event that's coming up in Lakeland, Florida, we actually have people coming in from Georgia, coming in from Tennessee. We have one person that signed up that's coming from, North Carolina. So what we're trying to do is we're trying to create these events to be able to create success for you guys. So make sure you guys sign up, whether it's our online learning platform or attending our boot camp, either or, you should take this. This is amazing information that you guys should actually have your company. If you have any questions, contact us, 630-340-8990. Email us, info@homehealthsuccessacademy.com. But all the information is in our website, homehealthsuccessacademy.com. Our online learning platform is 10xpatientreferrals.com. If you have any questions, always know that home health is easy. Home health marketing is easy when you guys know what you're doing. This is Michael Echeverria. I look forward to seeing you guys in the boot camp. And I look forward to talking to you guys on the phone. Have a great day.